All right, everyone, get ready for today because we are going deep on pancreatic cysts. I know, you're probably thinking cysts in my pancreas. Maybe not the most fun topic, but stick with us. We're looking at this medical paper, and we've got the latest guidelines from the American Gastroenterological Association.
Yeah, the AGA.
And you'll see it's actually pretty interesting. Plus, up to 15% of people in the US will develop a pancreatic cyst at some point in their lives. So, this is something that could really matter.
It's true. And what's really wild is a lot of people have these cysts and don't even know it. They're found accidentally, like you're getting a scan for something else and bam, there it is.
Like a surprise, right? An
Well,
incidental finding. But before we get into all that, maybe we should actually start with the pancreas itself. It's a small organ, but it's important, tucked away in your abdomen, about the size of your hand, the sources say. You probably don't think about it a lot, but it's doing a ton of work behind the scenes.
It's really incredible how much that little organ does. It's like a two-in-one deal, you know.
Hmm.
Produces hormones like insulin, which we all know helps regulate blood sugar. But it also makes enzymes that break down food, so digestion too.
A real overachiever, this pancreas of ours. So, if it's so important, what exactly are these cysts that form in it? And what causes them in the first place?
Well, pancreatic cysts, basically they're fluid-filled sacs.
Mm.
Imagine it's like a little balloon forming inside the pancreas. Why they happen? That's a little trickier. Sometimes we don't know for sure, but there's some usual suspects.
Like pancreatitis, right? Inflammation of the pancreas. Our sources mention that can be triggered by things like gallstones or if someone drinks too much alcohol or even some medications.
Exactly, you got it. And it's not just pancreatitis. Trauma to the pancreas, like say you have an injury or you've had surgery there, that can also do it. And then sometimes cysts are congenital, meaning they're there from birth because of the way someone developed.
Now, this is where things get even more interesting. The sources point out that we're finding more pancreatic cysts now than we used to because we're using more advanced imaging like CT scans and MRIs. And as you said, a lot of times it's a total accident. They find them when they're looking for something else entirely.
Yeah, that's a big point. We're seeing more cysts, but that doesn't always mean we need to do something about them. It's a bit of a, I don't know, a balancing act, figuring out how to manage these findings so we're not over-treating people.
A double-edged sword, right. Early detection is good, but it can bring some new challenges too. But hold on, before we get ahead of ourselves, let's break down the different types of pancreatic cysts. The sources highlight four main categories, starting with the most common one, which is pseudocysts.
Ah, yes, pseudocysts. Often after a bout of pancreatitis, you'll see these. And they're usually benign, meaning not cancerous. And the good news is, a lot of times they just disappear on their own.
But our medical paper does say that larger ones can cause some problems, like pain in the abdomen, so maybe not always completely harmless, even if they're usually not too serious.
True, true. Then we have what are called serous cystadenomas. Benign, again, filled with watery fluid. And they can be uncomfortable if they get big, but they hardly ever become cancerous.
Got it. So we've covered two of the common types, and they're usually pretty chill. But we've got two more categories to go, and these are a little bit more complex. Let's start with mucinous cystic neoplasms. MCNs is the shorthand.
Right, MCNs. These are more concerning because they have a higher chance of turning into cancer, often found in women, and the fluid inside is thick, which can be a red flag.
Okay, so those are the MCNs. And then we have intraductal papillary mucinous neoplasms, IPMNs. These develop in the pancreatic ducts, the tubes that carry the pancreatic juices, right?
That's right. And the thing about IPMNs is they can be kind of unpredictable. They can be benign, or they can be precancerous, or they can actually be cancerous already. Depends on where they are and how big they are, so definitely need to watch these carefully.
So we've got this whole mix of pancreatic cysts, some more worrisome than others. The big question is, how do doctors even figure out which type someone has? And how do they know if it's something to worry about?
That's where the real detective work comes in, you know. Doctors have a whole bunch of tools to help figure out what's going on with these cysts. Usually they'll start with an ultrasound. It's pretty simple, non-invasive, uses sound waves to get a picture of what's happening inside.
Makes sense, kind of a first look, right? But what if they need to see things more clearly? Our paper mentions CT scans, and they even describe it kind of funnily. They say it's like taking a slice of bread out of a loaf. So you get this cross-section, a really detailed view of the cyst, how big it is, where it is.
Exactly, good analogy. And then there's MRI, even more detailed, no radiation, which is always a plus. Sometimes they'll use a specific type of MRI called MRCP. That one's really good for looking at the pancreatic and bile ducts.
Okay, so ultrasound for the initial peak, CT for the detailed slice, and MRI for the super high-def image. But what if they need to get even closer, like right up to the cyst itself?
Well, in that case, they might do something called endoscopic ultrasonography, EUS for short. It's basically this thin tube with an ultrasound probe on the end that goes down your digestive system.
Like a tiny little submarine for your pancreas.
Yeah, kinda.
And the cool thing is, they can actually take a sample of the fluid from the cyst with EUS. And that fluid can tell them a lot about what kind of cyst it is.
You got it. Analyzing that fluid is super important. There's even this test called Pancreatic that looks at 22 different genes in the fluid. It can tell you with pretty good accuracy if the cyst is likely to become cancerous or if it's probably benign.
Wow, so we've got all this high-tech imaging and then this really detailed analysis of the cyst fluid. But for those of us who aren't doctors, what are the signs that something might be wrong? Like, what are the red flags that make a doctor think, okay, we need to look into this more carefully?
Great question. It's one a lot of people have. One thing that always raises concern is if they see solid components inside the cyst. Like imagine our balloon analogy. If there's something solid in there, that's not good.
Another thing the sources mention is something called dilation of the pancreatic duct, meaning the duct is wider than it should be, maybe because the cyst is blocking it or putting pressure on it.
Yep, that's another one to watch out for. And then, of course, there's size. If a cyst is bigger than 3 centimeters, that's usually when doctors start to get more concerned.
So we've got size, solid bits inside, dilated ducts. Those are the things that might make a doctor say, hold on, let's do some more tests. And then what happens?
Well, if they see any of those red flags, the next step is usually an EUS. And they might also do a fine needle aspiration, FNA, which is basically using a really thin needle to take a sample of the cyst fluid.
And I guess based on those tests, they decide what to do next. So let's talk about treatment. You mentioned earlier that not all cysts need to be treated, right?
Absolutely. If it's a small cyst and it doesn't have any of those worrisome features, a lot of times doctors will just recommend watchful waiting, or surveillance, it's also called.
So they basically just keep an eye on it, see what it does over time.
Exactly. They'll probably do imaging, like MRIs or CT scans every year or two, just to make sure it's not growing or changing. And if it stays stable for 5 years, they might stop the surveillance altogether.
That's good to hear, that sometimes it's just a matter of watching and waiting. But what about when they do decide to actually treat it? When is observation not enough?
Well, if they think the cyst might be precancerous, or if it's already cancerous, or if it's causing a lot of symptoms like pain, that's when they'll usually recommend surgery. What kind of surgery really depends on where the cyst is and what it looks like.
Our source talks about something called a distal pancreatectomy. That's for cysts in the tail of the pancreas. And they remove the tail, maybe part of the body of the pancreas too.
Right, and if it's in the head of the pancreas, they might do a Whipple procedure.
Yeah.
That one's more complicated. They take out the head of the pancreas, part of the stomach, the duodenum, some other stuff too.
Sounds pretty intense, those surgeries. Makes you realize how serious this can be in some cases.
It can be, yeah. But it's important to remember, surgery is usually the last resort, only when the benefits outweigh the risks.
This whole deep dive really makes you appreciate having a good doctor, someone who knows what they're doing. What kind of doctor should someone with a pancreatic cyst even see?
You're right, having the right expertise is crucial. The AGA guidelines actually specifically say that if someone's thinking about surgery for a pancreatic cyst, they should be referred to a center that specializes in pancreatic surgery.
So not just any surgeon, you need someone who really knows the pancreas.
Exactly.
And what about after surgery? Is there any follow-up, any kind of monitoring they recommend?
The AGA has guidelines for that too. Like if they removed a cyst and it turned out to have cancer or dysplasia, they recommend MRI every 2 years to check the rest of the pancreas.
Dysplasia? What's that? Sorry, just want to make sure everyone's following along.
Oh, sure, no problem. Dysplasia basically means the cells are growing abnormally. Not cancer yet, but it could turn into cancer. So they keep an eye on it to catch any changes early.
So even after surgery, it might not be over. They might need to keep watching things.
Yeah, sometimes. On the flip side, though, the AGA also says that if they did the surgery and there was no sign of high-grade dysplasia or cancer, then routine surveillance isn't necessary.
So it's not a one-size-fits-all thing. They really tailor the follow-up to the individual case.
Exactly. Personalized medicine.
Well, which is why it's so important to have good communication with your doctor.
Couldn't agree more. They can help you understand your risks, figure out the best plan, answer any questions you have.
This whole deep dive has been really eye-opening. I'm learning so much about pancreatic cysts.
Me too. It's fascinating. It really shows how much medical knowledge is always changing. We have to keep learning to make the best decisions for our health.
That's so true. And speaking of learning, this deep dive has actually raised some interesting questions for me. Our source mentions that finding pancreatic cysts, even if they're benign, can cause a lot of anxiety for people. It kind of makes you think knowledge can be a double-edged sword.
It really is. We want to find things early. We want to know more. But sometimes that knowledge can come with a cost. It can make people worry, even if the finding itself isn't dangerous.
That's a really good point. It's like, how do we balance the benefits of knowing with the potential downsides of worrying more?
It's a tough question, something for all of us to think about, both for ourselves and for society as a whole. As we get better at detecting things earlier, how do we manage that information responsibly?
Wow, that's deep. Well, this has been a fascinating journey into the world of pancreatic cysts. We've covered a lot, but it feels like there's always more to learn.
Always, that's what makes it so interesting, right? The quest for knowledge never ends.
And on that note, I want to leave our listeners with a final thought. We've talked about a lot of complex stuff today, and it can feel a bit overwhelming. But remember, you're not alone. If you're concerned about pancreatic cysts or anything else related to your health, talk to your doctor. They're there to help you.
Absolutely. Don't let fear or uncertainty stop you from getting the information and care you need.
Great advice. So if you're listening to this and you're thinking, wow, I learned a lot, but now I'm a little freaked out, remember, knowledge is power. And if you have any concerns at all, talk to your doctor. They can help you understand your own personal risks and figure out the best path forward for now. That's so important, finding that doctor you trust. It can feel like you're lost in a maze sometimes, especially with all this new information, but you don't have to figure it out on your own.
Definitely not. That's what doctors are for, right? They're like your guide, helping you understand everything, helping you make those tough decisions.
Yeah, it's a partnership, not a solo mission. And like we saw with pancreatic cysts, there's not one right answer for everyone.
Exactly. What works for one person might not be right for someone else. It's all about, what do they call it? Personalized medicine, tailoring the treatment to the individual.
Exactly. And that's why it's so important to be able to talk to your doctor openly and honestly.
Absolutely. You have to trust them, and they have to understand your situation.
This deep dive has really highlighted that. It's not just about the science, it's about the human connection too.
It is. It's about understanding how people feel when they get a diagnosis, making sure they feel supported.
And speaking of that, I think it's worth saying again, most pancreatic cysts are benign. They might need to be watched, but they're not necessarily a big deal.
Right. It's good to be aware of the risks, but you don't want to let worry take over.
So if you're listening to this and you're feeling a little overwhelmed, take a breath. You're armed with knowledge now. You understand more about pancreatic cysts than you did before.
And if you're still worried or you have questions, talk to your doctor. They're the best resource. They can give you personalized advice.
Well, this has been quite a journey. We've learned so much about the pancreas, all the different types of cysts, the technology they use to figure it all out, the treatment options.
It's been great sharing this with you. Hopefully it helps people feel more empowered to take care of their health and to have those conversations with their doctors.
I hope so too. I think that's a perfect note to end on. We've reached the end of our deep dive into pancreatic cysts. Stay curious, stay informed, and take care of yourselves.
That's it for today. Thanks for joining us.
And we'll see you next time for another deep dive.